there are obviously a number of very, very common health problems that people face when they go to developing countries, whether it's the first time or the 101st time. So I'll break the news to you right up front. You're all going to get gastro. Sorry, it's true. If it's not gastro from some kind of infectious source, and there's plenty of those, there's parasites, there's bacteria, there's viruses. People also get gastro or upset tummies just from a completely different change in diet. Are any of you guys vegetarian? Really, every shop that I saw was a butcher. There's a useful thought process before just all the normal changes of stream. That you think about what you're going to do when you get gastro, because did I mention you're all going to get gastro? Right, moving on from gastro. Oh, and there's worms too, but we'll talk about those. Then, of course, there's all the normal things. You know, if you're travelling in flu season, you should make sure you have a flu shot before you go. Colds and flus are just as prevalent in developing countries as they are here, and a lot of you doing your electives are either going to be working in hospitals or community health settings, and so again, that is an important risk to think about. Skin problems are really important. Kirsty and I were just talking about this before. So the first thing to know is if any of you are going to a tropical area, skin things don't heal as well in tropical areas. So you get bitten by a mosquito or a sandfly and you scratch to ignore it, it will go away, and if you can, you don't want annoying health dogs, but the cute before you go, because if you get impossible to get, entire African getting injured or getting injured as you would have here. The difference is that your access to healthcare may be very, very different, and I'll talk a little bit about access to healthcare when you're away in a second. So there was a really nice study done in the Lancet a few years ago looking at aid and development workers and the various illnesses that they get. Have any of you seen it? No? So this is a very, very, very simplified diagram, and I really only put it here for one reason, and that's to tell you that you're all going to get gas because you die from cardiovascular disease and wonderful infectious diseases. And I have a confession to make. And what I would recommend fresh water is really exposed to schistosomiasis, and I'm going to STIs and bloodborne viruses in developing countries than they are in Australia, although they're significantly common enough. But what I would say to you is important that you just remember prophylaxis if you were to have a needle stick injury or some other high risk exposure. Now, some electives will actually organise that as part of the elective. Some hospitals, depending on where you are, you may be very confident that you will be able to access it. But if you're not confident and you think that you are going to be working in a midwifery, an obstetrics, a surgical setting where there is a risk of exposure, get some PEP and take it with you. It is expensive. You can get it through clinics here. You can buy it online too. It's cheaper online, but you don't always necessarily know what you're getting, but you can buy them online. But take some with you, so just in case. Ideally, you'll have wasted $150, and that's a shame, but not the end of the world. But if you were to have a needle stick injury, you will feel much, much more comfortable if you've got PEP in your bag than if you have to go scrounging around trying to find it. Exist in various places. So around my back, and there was a scorpion in it. The other you're going and what you're doing, you may find that you are experiencing some quite distressing situations. You may see mortality, you may see a level of somebody that you can debrief with. Do you have someone else who's going to be on elective at the same time that you can keep in contact with to share those kinds of experiences? Do you have a partner or friends at home that you're going to be able to share them with? Because it is really, really important that not only do you deal with it when you get home, but that you are able to deal with it along the way as well. Some elective placements are extremely well set up for that, and some aren't. So it just depends a little bit where you are, or for medical students aren't as good. We travel in carriage, or 6 of you and 3 chickens you may be taking at any time. So had sheep's blood and cow. What I would say is if you're going to try to it and think about what you're going to do. Yes, and I don't have my little diagram. How people feel on their movement, and you're super excited. And things can get quite hard, and it's quite normal to have a bit of a drop in the way that you feel. And then of course people adapt and they reach sort of a normal level of being able to function and enjoy. And then in longer placements, there can be a dip again when people come home, because they come home, they feel they've had a life-changing, and in fact often have had a life-changing experience. They think everybody's going to be as excited about it as they are. You try to tell all your friends and they smile politely and go, that's nice. And they don't understand, and they can't understand how you've had this amazing experience, and so people often have a little bit of a dip again. So I'd encourage you also just to remember that those ups and downs are normal, and to think about, you know, how you're going to manage them beforehand as well. And that, because many people, truly, if you're in a rural and remote or well. At time, but if you're sealed blister packs, they look exactly the same as they don't always, but they often look exactly the same as the medications they're pretending to be. So be really careful about buying stuff over the counter, particularly antibiotics and anti-malarials. They're the most common, but any medication can be counterfeit. Now the problem with counterfeit medications are, well, there's a number of them. Firstly, they don't treat whatever it is that you're trying to treat. So if you have malaria and you need malaria treatment, not Panadol. Secondly, they are often Panadol, and if it's Panadol, well, at least it's probably not going to do you any harm unless you're taking it at high dose. But some of them, particularly some of the counterfeit medications, is also a risk. Never if it's Panadol for. But vaccines be covered for already.